To understand pericarditis, first we'll kind of outline the anatomy of the heart. So you've got just the heart with its 4 chambers. Surrounding it is this sac called the pericardial sac. And then you've got pericardial fluid in between there to kind of, it's kind of as a lubricant so that when the heart beats, it doesn't stick to that sac. But that sac is important there for protection for the heart. With pericarditis, this sac is inflamed, and that leads to excess fluid being accumulated in that pericardial sac. Lots of things can develop from this pericarditis, such as cardiac tamponade. Usually, so too much fluid causes this. So to kind of make it all make sense, this sac is rigid. It can't expand or contract at all. So if you get too much fluid, then the only way that it can go is in, and the heart isn't able to pump as effectively anymore because it's being restricted by that fluid in the pericardial sac. So that's kind of what's happening in cardiac tamponade. So cardiac tamponade, the main sign and symptom that you're going to see is an equalizing of systolic and diastolic blood pressure. So rather than having a blood pressure of 120 over 80, you're going to see a blood pressure of 110 over 90. And then it's just going to slowly get closer and closer until they're equalized. And that's super dangerous for your heart. So some things that we're going to see that cause pericardial infections or pericarditis is usually from a viral infection. There are some other causes like trauma, but for the most part it is usually caused by a viral infection. Some assessment findings that you're going to see is you're going to see chest pain that worsens when leaning forward, pericardial friction rub, you're going to see a mild fever, dyspnea, signs and symptoms of heart failure, things like that. So in order to actually diagnose pericarditis, we can do a CBC to look for white blood cell count elevated. We can look at EKG, we can look at a blood pressure, kind of analyze it and see like the trends of the blood pressure and what it looks like. We can do an echocardiogram, a chest x-ray. We can do a CT and MRI, EKG. There's also something called a pericardiocentesis, and that's just a big needle that comes in and takes out some of the fluid. And then we can analyze it, see if there's any bacteria, any viruses in it that could be causing this inflammation and the subsequent pericarditis, and maybe a cardiac tamponade. So when we figured out that this is pericarditis, some things that we can do is we can give your patient corticosteroids or NSAIDs. NSAIDs are really great for inflammation like this. Again, we have to assess for any of other contraindications with NSAIDs because there's lots of things that NSAIDs can cause as well. So some things that we need to teach our patient is we need to teach them that the pain is not due to a myocardial infarction. It may feel like it, but it's not a myocardial infarction that's happening here. We need to teach them that they need to be on bed rest or restricting activities until the condition is resolved. Teach them the signs and symptoms of a cardiac tamponade and when to be able to contact their physician if they go home with pericarditis. Teach them for monitoring for heart failure because we don't want the pericarditis to inhibit the heart so much that it completely fails.